Hi everyone, happy Monday. Dr. Alex Ritza here, downtown Toronto neurostructural chiropractor. And for today's Lunch and Learn, we're going to be talking about the neck, continuing on our discussion that we've been doing this month about your tight neck and shoulders and what you can do to help correct it. So what our topic is about today is discussing why when you go for a massage, if you're lucky enough to get to go for one every once in a while, or when you stretch your neck, why it doesn't last or the benefits don't last as long as you would like. So we had a practice member come into our practice recently, Heather, and her complaint was this. She noticed that she was going for massage, that it was lasting maybe only a couple of days when it had lasted, days, weeks, months, much longer before in terms of pain relief, in terms of stiffness relief, and some of the other benefits that a lot of people note when they get a massage. And so we had this discussion. And so we talked about massage and how massage is really, really fantastic. But we also talked about how massage really, really works. So we know that if you look at the research on massage says that there's very little actual breakdown of scar tissue or breaking up of adhesions or places where the muscles stick together. This happens to a very, very small extent. What actually happens during a massage is more of a neurological phenomenon. You have a change in the nervous system and in the reflexes of that spinal cord and of the nerves that go out and talk to the muscles, so that when you rub or you stimulate the muscles, it causes a nervous system change. And so we talked about this, and we talked about the chance or the likelihood of her massage, or the reason why her massage wasn't lasting as long anymore, is that the massage was not actually correcting the underlying core problem. And so, massages are great if you have a muscle problem, if you have a muscle tear or muscle strain or a muscle pull. But in Heather's case, we found that the actual problem contributing to her tight muscles was deeper. It was actually her spine and her nervous system. And so when we did her structural analysis, we found that her head was more than 1.5 inches forward, which for us, by definition, is a core problem in the spine nervous system. And when we did the rest of her testing, we found that there was some weakness in her upper limb musculature, her range of motion in her neck. Basically, we found that also all signs were pointing to core problem with the neck. And so because she had a core problem with the neck and the nerves that went and talked to all those muscles in the neck were not sending or receiving the right signals, of course she had a lot of muscle tightness. And so when she went to get a massage and she had those tight muscles worked, they would release for a couple days because there would be a nervous system change just in the muscles. But you hadn't actually corrected the real problem where the nerves leaving the spinal cord out into the shoulders and out into the neck had not been reset properly. So in our discussion, we talked to her that until we're able to correct her actual spine, make sure that it moves and sits stacked up in the structurally correct position, and until we're able to correct and optimize the signals that her nervous system was sending, it'd be very, very tough until we did that for those neck muscles to finally relax, like we're starting to see halfway through her care. So correcting those core problems in the spine and nervous system, the structural changes, but also the changes in the way the nerves talk to the muscles, really, really, really important if you find that stretching and massage is not giving you the benefit that you would expect it to. And so again, we want to make sure that those muscles are sending and receiving the correct signals. And the only way to do that is to make sure that the nervous system is sending and receiving them. Make sure the nervous system is healthy. And that's where, some of our corrective care processes are really, really helpful to people that have this very issue. And so if you find that massage and stretching is not helping like it used to, or you're not getting the relief, that's where a core problem in spine and nervous system you might want to have assessed, and it would probably be worthwhile correcting. Now, until you do that, I always want to provide as many drills, exercises, or tips, lifestyle-wise, so that you can help yourself, and hopefully you can do it yourself, and if you need professional help, you know someone. So what I want to show today is what we covered on Instagram actually this week, but I want to go over it again because some people are not going to see it, and I want to go over my favorite foam rolling drill for the shoulders. So we had a patient in today, and she's like, oh yeah, it's so tough to get this area up here on the floor with either your AccuBall or your lacrosse ball. And so using the door frame can be really, really helpful to target this area in here. through like the trapezius muscle or the levator scapulae or that first rib. So I really, really like doing this personally. I think it feels fantastic, and I think it's going to give you a lot of value in terms of helping with your tight neck and shoulders. So let's show this drill again. What we're going to do, you're going to get your ball. Tennis ball is going to be easier. If you're sadistic like I am on myself, you want a lacrosse ball. And so what we're going to do, the ball is going to sit between our shoulder, or between our trap muscle right here and the doorway. Perfect. So you can see balls right there. And then there are 3 ways to do this. We can either roll side to side along those tight muscles. If you find a spot like I have right here, you can do little circles and roll through it. Or you could just drive yourself forward towards the camera in this case. And I'm just pushing in on there, taking nice, easy, deep breaths in so that the nervous system is not tense, so the muscle can actually relax. And as that starts to relax and release, I can move over on the shoulder and focus on a different spot. So again, with a different angle, if we're going to pretend, let's make it crazy here. We're going to pretend here like that was that doorway. It's just in here like this. And so you work in through there, and you can get pretty creative. You can really target anything from the nape of the neck over to the shoulder, above the collarbone, all the way back to the shoulder blade. So you have this really large area that works well with this technique. Now, what I think works even better than the last 2 things I showed about rolling that ball across or in small little circles is adding some neck flexion in there. So again, ball, here I'm more at the nape of the neck, right by that first rib, and I'm leaning in with about 4 or 5 out of 10 pressure into the doorway. And I'm simply going to bring my ear away from the door and the ball, hold it for a couple seconds, and bring it back. And then you can bring it away, hold for a couple seconds, nice big breath in, and bring it back. And so you can move again the ball around. You can get creative here, moving the neck away. You can even move it down or slightly up. It's really up to you, and you can get creative because this is a very safe place to work. So with this, you can move the ball, you can move your head away to the side, say towards, oh Lord, we're gonna have to go time here. Say towards 3 o'clock. So you go 3 o'clock, you could go up to 1 o'clock, or you could go down to 5 o'clock with the ball there still applying some pressure. This, I think, is gonna be really a huge game changer for you guys if you have tight neck and shoulders. I think this would work really, really well at the office if you have the self-esteem to do so. If you don't feel like looking like a crazy person in the office, I would save this one for the end of the day after you build up some stress and some tension. Work through this when you get home, or if you want to look really cool, you could do it on the TTC on the subway. So I hope that's really, really valuable. If you know anybody that has this complaint of going to the massage therapist or stretching lots and not getting the relief that they want, please share this video with them so that we can bring some awareness to it. Also, if there's anybody that's looking for a good shoulder or tight neck stretch, this one is going to be a game changer for them. And that is all for today. I saw we have some comments on Facebook Live and on Instagram. I will respond to those. I hope everyone has an amazing day. It's Dr. Alex Ritza, downtown Toronto, neurostructural chiropractor, signing off. And you guys have a great week. Thank you.